Hi, Leah.
Hi, Kamna.
How has your week been?
So far, so good. I mean, it's first week of school for us back here, so we all
Oh
of
boy.
us have different first day of schools. So that's I think I talked about this last year. It's the worst week of the year. It's just
Hmm.
4 days filled with anxiety for all of us, for each other too. Also, can I just tell you this is really cute? My kids call each other their emotional support animals.
Oh, that is so cute.
They call each other their Essa because my daughter had to go today and my son goes tomorrow, and she's like, "I really needed my Essa today." And I'm like, "He'll be there tomorrow with you."
That
I
is
know.
really cute.
It's cute, but is it bad they're calling each other dogs?
No,
Okay.
my sister and I never even spoke to each other at school, so
Oh,
it's
okay. All
a
right.
good
So that's
thing.
all right. Yeah. Anyway, how about you? What's going on?
Well, I'm excited to introduce. We have a guest today. I'm really excited because we all both have a lot of questions. So, Mallory, tell me your last name again.
Gimo or
Jaimo
Giamo.
is a diplomat of Oriental medicine, licensed acupuncturist, and herbalist. I don't know how to say that, but she received her master's in classical Chinese medicine at Taoist Traditions College in Asheville, North Carolina, where she studied extensively with Jeffrey Wen, a 88th generation Taoist priest from the Jade Purity School. And at her clinic in Rocky River, Ohio, Mallory treats patients for general health and wellness, pain relief, digestive health, fertility, menopause, neurological conditions, anxiety, depression, and trauma.
I should
She
have seen you this
receives
week.
she receives favorable results by addressing the root cause of disease and discomfort.
Wow. All right. I have a million questions just from that intro alone. Okay. Which we might have to do two parts of this podcast, I'm thinking, because I want to do a whole episode just on the herbalist part.
Oh, yes.
But where do you want to go, Kam? To start with your questions first.
Well, I want to know about you. Like, how did you come to being an acupuncturist? And like, how it seems not a typical route for someone to take. So, how did you get here is what I really want to know.
Yeah.
Yeah, I get this question a lot. So thank you for asking it. And it's really
Again.
surprised me that it's such a common question, but I get it as to why that it is. So there's two parts to this. The first goes back to when I was really young. My brother and he's 18 months older than me, and he got really sick. His whole face and body were completely swollen. I believe he was probably like 6. And my mom did not want to do Western medicine. She didn't know what was wrong with him. The doctors didn't know what was wrong with him. He couldn't eat anything. And it was really uncomfortable for my mom to not have a diagnosis. So she started to do a bunch of research. And I don't know if you all remember, but Dr. Wheel was really starting to come up into the medical and alternative field at that time. And he's probably in like his 80s now, but he published a lot of like natural medicine books. So she started doing her own research, came to the conclusion that my brother might have an explosive case of candida. So she found an MD who practiced acupuncture and Chinese medicine. And this was in the 80s. And she went to him and she said, I think my son has candida. Can you help me? And he said, well, let me check your diagnosis and see what's going on. And he confirmed that what she had researched was true. So he instructed my mom on what to do as far as food therapy, lifestyle suggestions. My brother took herbs. As far as I know, he did not receive acupuncture from him just because he was young, but I know that they did do some acupressure.
Oh.
So this was quite a long process that my brother was uncomfortable, and then the unraveling of the candida plus other underlying issues that he had. And this doctor, in short, saved my brother's life. He
Wow.
not only supported my mom throughout the process, but gave her the tools from natural medicine and from food that helped him recover. And he no longer has any food allergies. He's,
Wait a minute. Wait a minute. Wait a minute. Are you saying that he got rid of his food allergies?
yes. Yep.
That's unbelievable.
Yep.
Back up
Yeah.
one more. When you say candida, you mean like yeast
Yes. So that's yeast
everywhere.
and fungal. Yep.
Just like in the blood and on the outside? Like what do you where do
Yep. His face was completely swollen and his limbs were completely swollen to the point where he couldn't open his mouth and eat and chew food. So it had consumed his cavities, his nasal cavities, his eyes. His
Oh my
eyes were like
God.
really swollen. Of
Oh.
course, his mouth, his limbs, his hands, his abdomen. And with just food therapy alone, I'm talking eating like really healthy, nothing processed, shopping the perimeter of the grocery store,
Mhm.
doing fresh and local as much as possible, and working to actively kill the yeast and the candida, which is where not only the food therapy came in, but also the herbs, because you can take antifungals from a Western perspective, but it doesn't necessarily mean that something that's synthetic and made in a lab is going to completely kill the bacteria, the virus, or the fungus. And that's where the herbs come in because they provide a natural resource to the body that we find in the earth that's ready to combat that fungus, that bacteria. It's grown from the earth to do that. That's its function.
when you say
I want to know.
Western
Oh, sorry.
wait, I just need
We're
to
talking over
clarify
time.
this. When you say Western medicine, you mean like doctors and eh, prescriptions.
Yes,
Okay.
pharmaceuticals and even
Pharmaceutical.
over the counters.
Okay.
Hmm.
All right. Sorry,
What
Connie.
I was gonna, I'm a little bit stuck on this story because how did your mom even know what to research
No,
and
this was in the 80s, right?
yeah,
It was
how
like
there was
the
no
best
Google.
processed food
Yeah.
ever at that in the 80s. Like you, because we didn't know anything was quote unquote bad. You know what I mean?
Yep. She spent a lot of time in the library. My mom comes from a lineage of women who were also medicine women and
Oh,
herbalists.
wow.
And
Oh,
so it's in her blood, it's in her innate instincts to be a mom who can use the resources around her to help heal herself and her family. And I think just those natural instincts that we've gotten far away from as
Mhm.
of late are what truly lead us to healing.
okay, wait. My other question, and I just slipped my mind. So go ahead if you have one comment.
No, I'm fascinated with the story because I think the way most of us get to where we're supposed to be is through these personal connections. And the story of your mom and how she used what she knew from her ancestors to
Mhm.
develop a way to treat
Mm.
probably both of you as children, get all kind of things. And for her to even have the sense to trust herself instead of people saying, "Why don't you just go to the doctor and just get
Right.
some medicine?" And she did that. That's really impressive to me. I'm
Hmm.
blown
Yeah,
away
Okay.
he
by
was
that.
so young. You think about these young kids, and our response is fear. And it's to just
Yes.
give them up to somebody else, give them up to the hospital, give them up to the ER. And I'm not saying those that Western medicine doesn't serve its purpose, because it definitely does. And I'm never going to deny a lab or imaging. But there's something to be said about saying, wait, my kid is so young. Like,
Right.
what are they doing? What are they eating? What are they coming in contact with that could be causing this?
Yes.
And
Yes.
that question alone is a catalyst for your brain to just go boop, boop, beep, bop, bop, bop. Let me look and see what's happening.
Yes.
Yeah.
And I think, that's what she did.
Wow. So you were younger, right?
Hmm.
When your mom, I'm assuming, and I shouldn't assume, but did your mom have to like totally change at the whole family's food? Did it make you mad, upset? You weren't like,
No.
"I want my Chips Ahoy cookies," or
We didn't eat like that
Okay.
anyway.
Okay.
I'll have to ask my mom, and I should have asked her before because we actually were talking about this past weekend, how old we were. But I mean, he probably was like 6, which
Yeah.
so that I was 5. And no, we didn't. We never ate like that. I mean, we had McDonald's every now and again.
Okay.
But once he received his diagnosis and then they started taking action, yes, we ate in season, we ate local meats, my mom had a garden throughout my whole life while I was living at home. We would get local produce from the Amish, from gardeners. She would trade,
Oh,
different
wow.
things that they would grow. No fruit juices, nothing that was put in a glass and found in concentrate. It's quite a lot when you look at what's behind packaged and
Mm-hmm.
Mhm.
contained products.
Right.
Um,
Wow.
I did he ever get like a diagnosis of one thing, or was it several things, or do you know?
from my understanding, the candida and the yeast were the biggest things. And then there were obviously some gastrointestinal. So I'm sure he would have been diagnosed with like IBS just
Yeah.
because he was so
Oh,
swollen and
yeah.
bloated and,
That's
going
what
from
everybody
constipation,
has, I feel like
diarrhea.
anymore.
Yeah.
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 All right, maybe this is a dumb question. Does that mean you guys don't, or you didn't? I don't know if you do now or not. Gluten? Does that include gluten?
So, gluten is a really big, interesting topic because gluten is found in a lot of grains, but not all grains are bad. And gluten in particular is highly sprayed and adulterated from the GMOs and the herbicides and the pesticides. If you were to eat gluten overseas, you're not going to have the same responses you would eat the gluten here.
Right.
Plus, we take into consideration how your body responds to different types of gluten. So I don't do really well with like whole wheat white flour, but I can eat rye and spelt and other grains, oats
Okay.
that do contain gluten, but that gluten is still a protein that your body needs that's filled with,
Mm-hmm.
B vitamins and folic acid and folate. But so
Okay.
it's unfortunately it's not that simple.
Okay.
Yeah.
So
Okay.
from
But
that experience at 5 years old, you knew
Oh
that
yeah.
you,
Go on back.
sorry,
Yeah.
I'm sorry. I just wanted to understand like how at 5 years old you had enough understanding of this is important to say, okay, this is something that's sitting in the back of your mind. And then when you went to pick a career, like, oh, this is it.
Right.
I wish it were that simple. So yes, that was a very pivotal point in my life, just watching my brother go through that, watching my mom be scared, and then watching her be filled with confidence because of what she was able to do for her kid.
Mm-hmm.
So, long story short, I grew up and I did my undergraduate actually in communications and public relations.
Okay.
And I went and
Okay.
moved after undergraduate to Washington, D.C., and was doing a lot of high profile public relations for NFL players and award shows. And I just wasn't happy. And I like to say that I cried, quit, and moved back to Cleveland and ended up getting another public relations job just to bide my time. And at that time, I was making a lot of money for someone that was 22 years old, 23 years old. And I just said to myself, I'm not happy and I know that this isn't my end game. So I started to do everything that I was interested in. Think about medical school, take some law classes, get chiropractic adjustments, think about being a nutritionist, maybe fitness. And the last thing that I tried was acupuncture. And I went to a lady down on West 6 because I was living on East 4th at the time, or East 6, West 6, West 6. And after that acupuncture treatment, I stepped out of her office. I came down the stairs, stepped outside, opened the door, and my world was completely different. I was in downtown Cleveland, and the sky was bright blue. The trees were bright green. The birds were singing the most beautiful sound. The wind just was like taking me over. I mean, I was like a character
You're
in
like a Disney
some,
princess
yes, in some like
downtown
show
Cleveland.
that was just like
Yeah.
la 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 down the street, like nothing. And I get home and I'm like, what is this? So of course I go back to her, and she was like not a nice person, was just like, get in, get out. And I left and I was like, okay, like I still feel pretty good. And I just went for stress and just
Yeah.
to try it out. So then I was like, if it's not her, then maybe it's just like another one. I'll try another one. So funny enough, I was at the dentist and I was telling this dentist kind of about this internal struggle that I was having. I'm not happy with what I'm doing. I feel like I'm supposed to be doing more, which is such a common
Mhm.
statement that so many, like, what's my purpose? I don't know. Like, I'm trying, I'm doing all this stuff. And she goes, why don't you go to my acupuncturist? He's an MD, he's in Lakewood. And I think you
Oh.
guys are really gonna, like, I think he's really gonna help you. So again, just going in for stress. I had some acne. I think I like stubbed my toe at the time. I'm like, just do whatever. And he was treating me. We would have conversations about life. And he was older. He's probably like in his 60s back then. And he knew the struggle, the mental struggle, the emotional struggle that I was going through. And he said, I think you would really enjoy being an acupuncturist. Why don't you look into schools and see what you think? So that just like lit me up inside, because I'm thinking to myself, you can do this? Like, you
Yeah.
can actually, this is a thing. So I started researching schools, deciding where I would want to live and didn't want to live because there weren't any schools at the time. I think the closest one was in Columbus. And I told my friend, I said, I'm going to go visit this school in Asheville, North Carolina. And she said, I want to go with you. I've always wanted to go there. And then it was just like everything snowballed. And I went back maybe like a month later for my interview with them. And I called my mom from the hotel room and she goes, are you okay? How's everything feeling? And I said, I almost don't want to tell you this, but this feels like home.
Oh
Oh.
my
And that was the
gosh.
moment when I realized, like, here we go. And Jeffrey Yuen, who is I've studied with, he's an 88th generation Taoist priest of classical medicine. So his grandfather taught him Chinese medicine from the spoken language. So nothing was written down. So it
Wow.
was really important to me to learn from someone who isn't just like Asian, but learn from someone who knew the medicine from the beginning. And that's kind of what got me hooked in that school. So it's a two-part story as to how it came to be.
Wow. Okay. So
That's fascinating.
what exactly is Chinese medicine? I guess is a question that I don't understand it.
Yeah, Chinese medicine is everything.
Okay.
It's our relationship with nature. It's
Okay.
our relationship with how we move with nature, how we live with nature. It's our relationship to food and using food as medicine and food therapy. It also has to do with how we rule our life and the choices that we make. So there's a big mental, psychological, emotional component to Chinese medicine as well, how we are relating to ourselves, how we are relating to our environment. There's also herbs in there too. Movement medicine, which a lot of people are familiar with, Tai Chi and Qigong. There's also self-defense as well, Kung Fu,
Oh, wow.
Jiu-Jitsu,
There's a lot
and
to Chinese. I had no idea.
yeah,
Me
essential
either.
oils, stone medicine. It goes really, really deep beyond just acupuncture is just one modality of classical Chinese medicine.
Wow. So he taught at the school in Asheville
hmm
and was there books and stuff or was it like,
Yeah, so there are books that were written thousands of years ago that
yeah.
have been transcribed that are considered our classical texts. And that
Okay.
goes back to the first many men who had documented these acupuncture points and herbs, food, movement. Sun Meow is really popular. Twanza is also popular, who
Never
said,
heard of
you know,
those.
Never
food is
heard it.
medicine. I, it was funny because I was thinking about like stating some quotes, and I'm sure if I said those quotes that then you would
We
know
would
exactly
know.
who it is. Karl Marx is really popular. He draws actually from a lot of classical Chinese medicine. Um, a lot of yogis do too. They take from Chinese medicine, but it is,
Something, you know, my first experience with acupressure, and probably, I don't even know if this is the right term. You can correct me, but um, I was somewhere and I was getting a headache, and my aunt said, there's no way to explain, but in the webbing between your thumb and your first finger to press, and she said, press this really hard and it'll help your
Mhm.
headache. Or even I went attended a retreat and they had a reflexologist and there was pressure points on the foot. I was like, this is fascinating in terms of how it's all connected through different parts of the body. Can you
yeah.
talk a little bit about that?
Yeah, your body is water and it is filled with oceans and rivers and banks, and it gets congested by dams. You know, we are nature, so our internal system is going to resemble that. And there are 12 acupuncture meridians that move throughout your whole body. They go from superficial to deep. So imagine that you're looking at the top of a river and you're like, I see that river. Well, that's a few acupuncture channels. And then you're like, wait, I can see a little deeper into the water. Look at the minnows swimming around. That's another set of acupuncture points and meridians and channels. And then if you look a little deeper, you're like, I can't quite see down in that murky water, but I can tell like where the bottom is. There's acupuncture channels and meridians down there too.
Wow.
So when you press on a point like this point, so it's a large intestine 4, and this is the command point for the head and the face, which would
You're
relieve
talking
the
about the
headaches.
point between the forefinger, the first finger and the thumb.
Okay.
Yes. Yeah, in that webbing.
Mhm.
And what you're doing, because you have a headache, there's a dam, there's congestion in your river. That's specifically the rivers that go to the head and the face. And so when you press on that acupuncture point, you're almost like pumping the water in your body, saying like, change, change, change. And you're creating this current in your system that then is opening and dispersing what might be clogging or causing the headache. So it's like you have a dammed river, you want to unclog it, and then you press on this acupuncture point and it opens it up. And I'm sure, Kamna, when you pressed on it, you might have been like, shoot, that's sore. That feels
Yes.
uncomfortable.
Yeah.
Yes.
Yeah. And that's
It was
just
very
the,
painful. I'm like, ow, ow, ow.
yeah, the dam in your body. Yeah.
So
That's
you're
fascinating.
so you're saying it hurts because you gotta like release the dam that's right here.
Yeah. Release the pressure.
Wow.
Mm-hmm. Yeah. We are meant to be open vessels. Life is meant to be easy and free, and we're supposed to have calm waters.
Mm.
And that's our internal system. We want to be able to open them and release the pressure that we put on ourselves, that society puts on ourselves. And so when you start to look at your body like water, you can see how easily and quickly it can be changed. And that's why acupuncture is so effective, is because it has such a swift impact on the system.
So when I think of acupuncture, and I don't mean this to be insulting, this is the picture that I get is like what you see on TV with all the needles and you're laying on the bed. Is that what it is? And it sounds painful to me. Is that how does that work?
Ideally, yes. So, in speaking specifically to my experiences and how things are in my clinic, you'll come in, you'll lay down on the bed, and then you will feel the initial acupuncture insertion of the needle, which is a single use disposable needle. So they're not washed, they're not reused. They come in clean, sterile packages. And when you feel that prick, it kind of feels like a little less than a bee sting. You'll feel it, but it doesn't create such like a shocking impact, I think, because
Okay.
people know that it's coming. And there are certain techniques and ways that acupuncturists can insert the needles that cause less pain than others. Sometimes we'll use like a tube to guide the needle in and tap it in. And that way people feel the pressure of the tube instead of like the needle insertion. And then once the needles are in, you just lay and relax. I would say probably like 95% of my patients fall asleep,
Oh,
because again, it takes the pressure off of the body. It relaxes the nervous system. I like to say that it does the work for you and assists your body in calming and cooling and clearing and nourishing and repairing and tonifying and strengthening.
Okay, so if I came to you, you're going to talk to me first and figure out where I'm struggling or what I'm coming to you for particularly, right?
Yes. So again, I'm just going to speak to my space,
Right.
and I know a lot of other classical practitioners practice this way. We will talk to you. We want to know what's going
Yeah.
on, what your main concerns are, and you speak to us like you would talk to any doctor. I have
Okay.
anxiety, I have depression, any other diagnoses that you have. And then we'll put that through our funnel of classical Chinese medicine diagnoses and then treat from there.
and is acupuncture good for everybody, or would it be specific to the case?
Nope, everyone can benefit from it.
Oh,
I even do it on my animals.
really?
Really?
Oh
Do
yeah.
they like make a ruckus when you're trying to do? No, they know.
No. Yeah. Yeah. It's like, imagine if and I'm sure you've probably had this experience, but you go into the doctor's office and they're just like, hello, hi, what's going on? Okay, tell me, and they're just like, and you're like, oh, I don't know if I want to interact with this person.
Right.
And then someone comes in and they're like, hi, I'm Mallory. Nice to meet you. Did you find the place okay? What's up? Tell me what's going on. I read your, paperwork. It's like the feeling that you get is what's going to allow kind of your guard to come down and for them to treat you in a
Sure.
way that's caring and compassionate and empathetic and loving. And because animals can't speak, they feel that. My dog knows that when I'm coming at her from like, I'll first start with like a little bit of acupressure and, you know, kind of
Okay.
warm her up a little bit and then put the needle in. Yeah.
Okay. So what exactly is happening to the body when you put that needle in?
Yeah, good question.
Like, I don't know if
Yeah.
I'll even understand it when you explain it, but like, I mean, I'm also assuming that there are certain spots on a person that you put it. If, like I said, my shoulder and my arm are hurting, you would have specific spots. You're not just sticking them anywhere you feel like it, right?
Right. Yeah. So it really depends on what somebody's coming in for, whether it's going to be physical, mental, emotional,
Okay.
digestive is
Oh,
it's all going to change. And I spoke to this a little bit before, but we have certain diagnoses, but also actions that herbs and acupuncture take. So we can clear heat from the body. So if you're hot, that's obviously we want to clear that heat. If you're anxious or restless, you're creating heat in the body. So we want to clear that out from the system. If you have shoulder pain, we don't want to go right to the source of the pain. We want to check the muscles surrounding that area because they're also engaged in the pain. So palpating and touching is also something that we do diagnostically too, um, to find out not only what muscles are involved, but where the source of the problem is, because often where people have pain is not where the issue it actually is.
mhm.
Um, so to answer your question, we can do a lot. We can calm the mind, we can relax the body, we can down regulate the nervous system. So take you from fight flight to rest and digest. We can clear what we consider dampness and phlegm. And so that would be like stickiness in the body. You've got it coming out of your nose or maybe your ears, or you feel bloated. That would be dampness. It's excess water in the system that's accumulating in the body. Um, you ladies, I know, are well aware of weight. And if someone's carrying excess weight, a lot of times it's not just fat. A lot of times it's water. And inflammation is water. It's the body's way of protecting the system. And so by clearing and draining that dampness, we're going to be able to help the body move that water, clear and open that dam so that then they can poop it out, pee it out, sweat it out, and take the pressure off of some of the organs and the channel systems so that they can work more effectively, because the body or whoever it is just doesn't have the resources to be able to do that, whether it's physical resources or mental resources. Yeah.
So
Wow.
you stick the needle in and it's like in your muscle?
Yeah. So it goes through many different layers of the body.
Okay.
And it can go into the derma layer, which is just the skin. So again, like that very superficial layer that I described before, you're looking into the water and
Right.
you see some stuff.
Okay.
So that would be like the superficial. It goes into the blood, which is going to be more the moderate level and the muscle system. It can go into the deep level, which is influencing the DNA, the bone. And then, of course, we're going to be tapping into the lymphatic system. I do a lot of neurological acupuncture, so I'm looking to engage the nerves. So I will actively be touching nerves of the body. And a lot of acupuncture does touch nerves and engage the nervous system, because the nervous system is the complete source of the body. If we don't shift the nervous system, it's difficult to shift the rest of the body, because everything is connected to the nervous system. The nervous system is connected to everything in your body.
I want to ask you a question because I don't think I have a full understanding of what this does, but if you have a condition like IBS or anxiety, depression, which isn't like you have a swollen knee, or it's not a physical ailment, how does acupuncture treat that?
Mhm. So we would want to know how the IBS specifically is manifesting for you. Are you bloated? Do you have gas? Do you have diarrhea? Are you constipated? Do you have acid reflux? Those symptoms are going to diagnostically help us to understand which meridians and channel systems and organs are being engaged in your body. And then from there, we're going to take your pulse and look at your tongue, which is going to help us further determine which organs are involved and then treat from there. So, if
Looking at
you,
my tongue?
mm-hmm.
Really?
Oh,
What do
yeah.
you see? I mean,
I
like, is it
know. I want to stick my tongue out at you right now and see what you see.
Yeah, we can. Well, I'll put a little plug in there. So I have a podcast as well called Through the
Oh,
Funnel, and I did an
oh,
entire episode about tongue diagnosis.
oh, we'll
So
have to listen to that for sure.
it's a complete diagnostic system. So that's a whole nother conversation. But yeah, we can tell if you have candida, we can tell if your liver's under stress, we can tell if you've had diarrhea, we can tell
From our
um,
tongue?
even if your heart is congested.
wow.
If your liver or kidney, we can see all the organs on the tongue.
Okay, can you also, this is, somebody told me this forever, like forever ago. Can you tell by looking at someone's tongue if they have their period?
Yes.
Uh, that's true?
Yeah. Yeah, it's interesting because if you think about it, the thing that I love so much about Chinese medicine is that it's so simple and logical. It just makes sense. So when a woman bleeds, we lose blood.
Okay.
And every bit of energy and consciousness and quick thinking that we have is kind of like less than, we feel pretty like depleted. Well, that's because we're about to lose a bunch of blood. So
Mhm.
the tongue, we want it to be like nice and pink. And when a woman is about to get her period, it turns more pale because all the resources and blood that we have circulating is starting to just slow down and drop to the body to be able to bleed and let go of the period. So, of course, we're going to be less than above than
Yeah,
we are
duh, like,
below.
that makes so much sense, though. Like,
Yeah.
So this is weird, but in your training, then you have to look at tongues and really understand the different things for different organs. And
Mhm.
that's
Yeah.
fascinating.
Yeah. No tongue is the same, but the way Chinese medicine looks at the tongue and diagnostically has like graphed it out like a map, they're all the same. It's all the
What do
same on
you think
everybody.
of tongue cleaners?
Yeah, tongue scraping, I personally don't recommend because the tongue creates the coat for a reason. And if you scrape that off, you can be impeding on a potential band-aid that the body is putting on. The body could be trying
Oh.
to work to clear something that then you're just ripping it off. You're also moving the taste buds, and they although the tongue is a muscle, they have their own cleansing process too. Brushing the tongue is fine, but kind of, repeatedly scraping with a tool is not something that I recommend or Chinese medicine talks about at all.
Really?
I think simply because we want to see how your digestive system, how your kidneys, how your liver, how your gallbladder are processing or not processing the food and resources and information that's coming into your body.
Wow, so okay, so another tongue question, I know we're all over the place. Let's say
Listen
you
to the
have a blister
podcast.
on your sure, can you tell yes, for sure, that's you comment, we gotta listen to that
Oh,
this week.
yes.
Um, if I have a blister, like, on a spot on my tongue, is that reflective of an organ in my body?
Uh-huh. Yeah, same thing with like cold sores. Yeah. And it's interesting that you bring that up because a blister, cold sores, that's heat. So there's probably a particular organ in your system that's carrying more heat than others. And we can have heat in our heart. That's anxiety, that's restlessness, that's heart palpitations, sleeplessness. We can have heat in our liver and gallbladder. A lot of times we'll see that as like acid reflux, feeling hot, agitated, menopause, angry, frustrated, irritability
Wow.
can all be heat
What
related
is
symptoms.
what is the, if you can tell us, like the biggest transformation you've seen after acupuncture?
Good.
Mm, well, um, I'll start with one of my favorites, which I see often so I do a lot of women's health, and I have helped about 35 women conceive with
Wow.
just acupuncture. So seeing their babies.
Wow.
Yeah,
That's
it's
unbelievable.
Chinese medicine does women's health so well. I've had women who had their period and then don't have their period, get their period back with Chinese medicine. I've had women who have had really heavy periods, slow that down. I've helped women move through menopause seamlessly, or to help them, move through the symptoms in a more comfortable manner.
Mhm.
One of my favorites is a patient that I saw today. Actually, he's a 35-year-old male, and he has a condition that his limbs, his lower limb on his right side, did not grow to the capacity of the rest of his body. And it's very similar to like a cerebral palsy, if you're familiar with that. And I've been working with him for about a year. So we're doing a lot of neurological acupuncture, but we also do a lot of lifestyle and food therapy suggestions. I do a lot of health coaching as well, which I kind of put under the mental, emotional side. And I saw him today, and the first thing that I said to him after he kind of told me how he's feeling, I said, "You look masculine. You look like a man." And this guy, when he first came to me, was very thin, withered, depleted, skinny, didn't have a lot of resources, was drinking a lot of coffee, was hardly eating, was working a lot, was stressed, wanting to provide for his wife and his soon to be family. And he did the work. And that's what Chinese medicine does, is it helps guide us and provide us with resources, information, so that we can go and fulfill our physical body and our minds and our needs. And he is, I wish I would have taken a before and after picture of him, because he's just that image of someone who physically and mentally looked depleted, who now looks like this guy with great broad shoulders. And he's talking about how he's weightlifting, and he's talking about how he can move his toes, which he didn't have access to before. And how he wants to start running and doing kickboxing. And so he's a
That's
good
incredible.
one.
It has to make you feel so good.
Mm-hmm.
I love what I do. I'll probably do it until I physically can't anymore, which
Yeah.
hopefully will be never, but it's such a gift. I haven't seen a Western physician in over 15 years because there's
Really?
no reason
Really?
to. Yeah.
What? Okay, so how do you know, like, if your cholesterol is high?
It's not. I just know.
Really?
I would have symptoms and discomfort. And, like I mentioned, part of this process, when you engage with your body and you build a relationship with your body, is knowing what your body likes and doesn't like, and what your body is comfortable with and uncomfortable with. And a lot of us disassociate from our body, or we just like don't listen, or we don't pay attention, or we
Mhm.
just want that quick fix. And acupuncture allows us to slow down and to connect with our vessel, connect with our vehicle. And when something is off, your body is going to tell you. So I've learned to listen closely. And, I'm not perfect. Like, I've ignored some things, and um,
Yeah.
it's just kind of the way that life is. But I haven't felt the need to. I've had COVID. I've had digestive issues. I've had worms. I've had heart stuff. I've had knee issues. Um, I've gone through a lot that Chinese medicine has just been able to
Remedy?
heal.
Yeah,
Yeah,
yeah.
not even remedy, heal from.
Wow.
Okay, this is a weird question too, but does insurance cover acupuncture?
Some insurance companies do.
Oh,
However, they limit what we can do. So when you involve an insurance company, there's always a code. And that means there's a code for back pain, there's a code for knee pain, there's a code for irritable bowel, there's a code for headaches. And so if you come in and you have something that doesn't match a code, either I'm going to have to like say I did something with the code, or then it wouldn't be covered.
Mhm.
I don't take insurance because I want the freedom to be able to, meet people
sure.
where they're at and treat them with what they need. But you can use your health savings account or your flex savings account too. That's a nice way to go through with it. But I like to think of healthcare in this way as like a gym membership.
Hmm.
And even if you come once a month, it's going to be about the price of your gym membership. and you're exercising, you're right, and your desire to get closer to your body and to take care of it.
Wow. Keep going.
Do you have a place where people can find you on social media or website?
Yeah, my website is sourcemedicinalarts.com. And then you can find that on Instagram. And then also my name, Mallory Jimo. I have an Instagram there. I'm not super active. Sometimes I am, sometimes I'm not. And then I'm on YouTube as well. So you can
Oh,
find my podcast there as well as on Spotify.
And your
Um,
podcast is called Through the Funnel.
mhm,
Okay.
okay. So I know what I thought of. Were you, and I talked to somebody and I'm hoping it was you. They're talking about fatty liver.
mhm.
Is there like specific acupunctures that you do for that particular quote unquote problem?
Yeah,
Wow.
yeah. So
And
it,
yeah,
mhm.
go ahead.
So again, fatty liver is congestion. So it's a dammed river, and we need to clear that dam of the sludge and the excess and the congestion. And so there are acupuncture points that are going to drain dampness, that are going to open the liver, that are going to reduce excess. And so that will help to, those points will help to relieve the pressure on the liver.
Does anybody ever get sick afterwards? Like, do you feel like if you're relieving all of this gross stuff, I don't know if it's gross
Yeah.
stuff. That's how I imagine it in my body. Am I gonna like, do I feel like yucky afterwards or you just usually feel so good?
I think that's going to depend
Okay.
on the acupuncturist and their style and how they do the intake and converse with you. Because, yes, you can certainly dislodge things and cause you to, have to pee or have a bowel movement or maybe have a headache afterwards. We're all energetically a little different, and acupuncture is an energetic medicine. And
Okay.
so my job is to meet you where you're at,
Okay.
not make you go faster
Right.
than where you want to go or what your body wants to do. So sure, it's possible,
Yeah.
but
What's the most,
more
sorry,
often than not, you'll be fine.
Okay.
Yeah.
what's the most common problem that you see?
I'm going to say this a lot, but it depends. It
Okay.
depends
Yeah.
seasonally.
Mm.
It depends on just, I'll see things in waves. There are times when I'll have like 6 or 7 girls who are trying to get pregnant, and then I'll have 2 or 3. They're like right now it is a great time for physical injuries. Kids are playing sports, people are running triathlons. Um, Dads are throwing footballs more than they should be. Um, there's, I see a lot of like anxiety and depression and trauma. Um, that just kind of depends. I do see a lot of digestive issues.
You
That
see
tends to be more like around the
like
holidays.
skin stuff too, like
Mhm.
acne and psoriasis and that kind of stuff as well. Do you see that?
Yeah, and that would be something that we would consider like a branch system or a symptom. So meaning there's a larger issue going on that's causing the psoriasis or the acne. So the psoriasis and the acne are not the root of the issue.
Oh,
So we would look more towards other symptoms and issues and discomfort that you're having that would then cause the body to push toxins out to the skin to relieve it, because your body's going to want to try to clear heat anyway.
wow. Okay, wait, I have another question, and I hope this isn't rude. To anybody that's listening right now.
Go
If
on.
you feel like you're larger person or you have more fat in certain areas, does it matter? Like, do you have to push the needle in farther? And is it more painful if you have a lot more? Do you know what I'm trying to say? Like,
Yeah.
you still
Usually
get the
people,
same benefits as,
sure.
yeah,
Yeah. Usually people that have more cushion, more
yeah.
space, I don't usually say this, but yeah, we would have to use a longer needle
Okay.
just to get to the nervous system. We'd have to get through that fat, that water, just to engage the area of the body that is, again, underneath that water. But I
But
see
you
people of
Yeah,
all
I was gonna
shapes
say,
and
but it's still I
sizes
guess what
and
I'm questioning is, like, it's still going to be helpful to anybody of any size.
mhm.
Even if you're really you're muscular or like me, squishy, like,
Yeah,
you're gonna help all types. Okay.
yeah, yeah, absolutely.
Okay, I know I have more, but I can't I'm so intrigued by this whole thing so much.
My best
What I
advice
Yeah.
sorry.
would be to just get a treatment and
Yeah.
to maybe like look up acupressure, like common acupressure points for whatever you're
Mhm.
experiencing, or shoot me an email and I'll send you some, and just do the acupressure on yourself and see how things change, see how you feel. I think on my YouTube, like a long, long, long time ago, I did a video on how to do acupressure.
Ooh, okay. Good
So you
place
can
to
check
start.
that out too.
Okay,
Okay, so I have a question specific to me, and I
okay,
don't
wait,
know if anybody else is okay, go ahead.
wait, before we do that one real quick, how long was your schooling?
4 years.
Oh,
Oh,
wow.
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 Yeah. And
It's so
my
fascinating. Anyway.
the president of my school, she is a hell raiser. And she wanted students that could communicate with Western doctors. So we had a lot of Western training. We had pharmacology training, we had anatomy, physiology. Um, she wanted us to be at that level. And I'm so grateful for that because I can come and talk to you guys in confidence, but still be able to feel like I'm relating to what you're going
Mhm.
through and
Right.
how, keep it simple. So being
Yeah.
able to speak to multiple audiences was something that she wanted to do,
I
wanted
think
us to
that's
be able
fantastic
to.
because 'cause you've
Yeah.
talked about food and herbs and lifestyle, and all of that is I mean, that's what I believe, that it's a holistic picture,
Mhm.
Hmm.
and I think that's a fantastic way to approach this.
Hmm. I
Okay,
love it so much.
what's your personal question?
Okay. Uh, I know nobody else is gonna care about this, but since you're here, I wanna ask you. Um, so every time I eat, every single time, I get really bloated, and it's very uncomfortable, and my calorie and my, macros and all of that is all in line of where it should be. Every single time that I eat, I get bloated.
Hmm. So if you first of all, massage the point spleen 9. It's going to be on the inside of your legs, and the acupuncture channels run on both sides of the body, so bilaterally.
Okay.
It sounds like you're congested
Mhm.
and that this has been a chronic thing, and your body is just kind of like, this is the way that we are. Nothing's really helping. We're kind of getting the same things. And so this is just the way that we are. And we get stuck. It's like when I see people with shoulder issues,
Yeah.
they're stuck, and then we have to engage the muscles and move the muscles to help then their shoulder to be able to move more freely. And that's what acupuncture is going to do for the digestive system. Um, and then, I would certainly engage a conversation and want to know like what you're eating. What do you eat the first thing in the morning? What do you have for breakfast? What are your favorite foods? What are your staples? And do a lot of food therapy because unbeknownst to Western medicine, and I hope they figure this out in like the next 200 years, is bloating is not your small intestine and your large intestine. Bloating is caused because your liver is overburdened. And when your liver cannot process because it's a filter, then your digestive system, because it's in the cascade of events and processes in your body, if your liver can't process something, then your small and large intestine are going to bear the burden of that. And they're just going to get flooded with water because your liver is like, hey, I'm trying to push this stuff through the dam and I'm stuck. And so the dam is just damming all this water and all this water is getting backed up. And as a result, you, large and small intestine, are just going to have to bloat because you're just not getting enough resources. And so keep that idea of your body as a river and everything that happens to a river in your mind when you think about how you're feeling and what you're eating. And that spleen 9 acupuncture point it's probably gonna be really sore on you, Kamna. But you're gonna find that you'll actually feel less bloated and more
I'm
relief.
gonna go and watch that YouTube
My
video right
God,
after
you have
this.
to tell us how this goes. Okay, I thought of 2 more questions. What age is there an age? Like my 15 and a half-year-old wants to get acupuncture for sinuses so badly. And I'm like, I don't know if is he too little? Not little, but you know what I mean, too young? Does it help
No.
with your sinus stuff?
Yep.
All that.
Yes.
Okay.
I've seen kids of all ages.
Okay.
My nieces are 2 and 6, and the 6-year-old has had acupuncture since she was 3, 4 months.
Okay.
You can do acupressure on them. We have specific needles for like little babies and kids, but everybody, there is no discrimination.
Okay. And
Yeah.
then my other question is about you personally, and you don't have to answer this, but do you eat ice cream?
That's a good question.
So I will eat ice cream. It's not my favorite thing. So
Okay.
that's kind of, like I could tell you other bad things that I like.
Okay, yeah, that's what I
But
mean. You do though, like,
yeah,
yeah,
I
okay.
live life.
Okay.
Yeah. And we believe, Chinese medicine is about enjoying life
Yeah.
and enjoying the things that we have in this era, in this
Right.
time of life that we're in. So, yeah, I mean, I'm a big sucker for like a really good chocolate chip cookie, but
Okay.
Oh, yes.
I mean, I'm going to want it, with good quality local milk and, good,
A
um,
good cookie.
yeah, a good
Yeah.
cookie. But sure, am I going to eat one that's like not good and still enjoy it and not hate myself for it? Yeah, of
Okay. All right, good.
course.
Because I'm sitting here going, I think I'm having ice cream later. Not really, but like, and then I'm like, oh, do I do oh,
No, 80/20. Even
okay.
patients, like I'll see cancer patients and I'm like, look, eat the effing cookie,
Yeah.
please. Because if you're either gonna stress out about not having the cookie or you're gonna stress out about having the cookie. So just eat the cookie,
Yeah.
love it
Right.
Enjoy.
and enjoy
Yeah.
it. And,
Okay.
don't have another one for a couple days.
Oh my gosh, you're
That's so
so
good.
fascinating. So fascinating.
Oh,
Come on, we
thank
might have
you.
to go there and both get
I know, I want
Yeah,
to.
we might
come.
have to.
I have to
Would you
Come
find
do
join
it
out
me.
where this
together? Could we do it together or you don't do it together?
I don't have 2 beds in one room, but you
Okay.
guys can definitely like one of you could go trot around the
Yeah,
Rocky River area while I treat the other, and then while one's resting, I'll treat the one, and then
we should do
we'll
it,
like
Kamna, for
bounce
real.
around.
for real.
Yeah, all right, we're
And
gonna
Kamna, you look a little reserved about it.
I
I
think
am so in.
she would
Okay.
totally do it. Yeah.
I have had so many problems that I'm trying to fix on my own, especially after getting trained. And I've had progress, but I still feel like I have a long way to go and I feel like I've hit a wall. So,
Hmm.
and I think this happens to a lot of people where you're trying things to fix your internal problems, like you said, intuitively, you shouldn't have this or you should have this food wise or lifestyle wise. But then you hit a wall of lack of knowledge or lack of experience or just
Yeah.
anything. So,
Yeah, it's hard to be our own healer. And I have plenty of examples of being in situations where I'm calling my fellow Chinese medicine physicians and I'm like, SOS, I'm doing everything right, but it's not working.
right,
And the body likes to stay safe. It likes to be in what's familiar. And
right,
acupuncture just has this way of saying, like, it's okay. You can let go. You can accept. You can process this. It's like that first experience that I had, it was like she popped balloons on me of just like stress and tension and tightness, and it just lifted it from my body. And yes, did my body have the predisposition to go back that way? Yeah, but after treatments and then learning different ways to manage stress, it's like my shoulders have never felt better.
Wow.
So
That's
yeah, it just,
amazing.
I mean, it takes the pressure off and it tells the system like, hey, we're going to help you out and you're going to go this way instead of that
Sure.
way, or we're going to unclog you a little bit.
Wow. So cool. Well,
Well,
thank you
thank
so
you.
much. You took up so much of your time and I really, really appreciate it so much.
Yeah, thank you, girls, you guys, ladies, whatever we are at this age.
Yeah.
You're wonderful. It's really good. You had some great questions and
Well, we will be
I enjoyed
contacting you.
it.
We really will be.
For
Yep,
So
sure.
please do.
Thank you
nice
so
to meet you.
much.
Yeah, thank you. I
Bye.
really appreciate it. Bye.